The goal for a value-based reimbursement model is simple: improve the quality of care while lowering the overall cost of care. Most healthcare leaders believe value-based reimbursement models will be the primary revenue model for U.S. healthcare in the future. About 1/3 of healthcare payments made last year were associated with the value-based model, showing a steady move away from the traditional fee-for-service model. This, in essence, represents a system where we no longer reward for volume. We now reward for better results in terms of cost, quality, and outcomes measures. There are a lot of different programs within the value-based care model. There are programs based on shared savings. So what an organization spends below a target amount, it can share some of the differences as a bonus. In the same light, there are programs based on shared risk. So when an organization spends more than the target amount, it must repay some of the difference as a penalty. Another common program is bundled payments, which provides a single payment for multiple services addressing a single condition. This program allows an organization to keep the money it saves through reduced cost. The market shift towards value-based care presents unprecedented opportunities and significant challenges for healthcare providers. We believe one of the biggest areas you must address in order to implement an effective value-based program is the ability to drive medication adherence. Prescription medication is the largest therapeutic treatment for any disease state. That is the treatment plan provided to the patient to drive the desired outcome. However, lack of adherence to the medication treatment plan accounts for up to 50% of all treatment failures and approximately $400 billion in wasted healthcare spending. As I mentioned before, the goal of value-based care is to improve quality of care and lower the cost of care. So you can see how medication adherence sits directly in the crosshairs and must be addressed to reach the desired goals of the value-based programs. It is becoming more difficult to manage these medication plans for patients. Lack of access to data of current medications, large volume of new drugs on the market, an increasing percentage of the population with chronic conditions, and an increasing percentage of the population that are polypharmacy patients. 42% of adults aged 65 and older take 5 or more concurrent medications. Healthcare providers must proactively incorporate pharmacy as part of the care team, and they must have access to the data needed in order to make critical medication decisions at the point of care. That is why we created Exchange Point, to provide the ability to target and stratify these high-risk patients, to provide access to the data related to their medication plan, and drive intelligent interventions with patients at the appropriate intersections of care. Exchange Point has proven to be an absolute necessity to improve quality of care while also lowering the cost of care.